In this lecture, we will discuss about the cranial foramina, and the contents passing through the foramina of the skull. What are cranial foramina? Cranial foramina are openings in the bones of the skull, that allow the passage of nerves, blood vessels, and other structures. They are critical for communication between the brain and the rest of the body. Now we will have an overview of cranial foramina by fossa. Cranial foramina are categorized by their location in the type of cranial fossa. This includes anterior cranial fossa, middle cranial fossa, posterior cranial fossa. What are the foramina of the anterior cranial fossa? Two foramina pass through this fossa: foramen secum, cribriform plate. Following contents pass through this foramina. Foramen secum occasionally transmits a vein from the nasal cavity to the superior sagittal sinus. Cribriform plate, also known as olfactory foramina. It is a perforated horizontal plate of the ethmoid bone, located on either side of the crista galli. It allows passage of the olfactory nerves. Cranial nerve 1. What are the foramina of the middle cranial fossa? 6 foramina pass through this fossa: optic canal, superior orbital fissure, foramen rotundum, foramen ovale, foramen spinosum, foramen lacerum. Following contents pass through this foramina. Number 1. Optic canal, transmits optic nerve, cranial nerve 2, ophthalmic artery, sympathetic fibers. Number 2. Superior orbital fissure, transmits oculomotor nerve, cranial nerve 3, trochlear nerve, cranial nerve 4, ophthalmic division of trigeminal nerve, abducens nerve, cranial nerve 6, ophthalmic veins. Number 3. Foramen rotundum, transmits maxillary division of the trigeminal nerve. Number 4. Foramen ovale, transmits mandibular division of the trigeminal nerve, accessory meningeal artery, lesser petrosal nerve. Number 5. Foramen spinosum, transmits middle meningeal artery and vein. Number 6. Foramen lacerum, transmits greater petrosal nerve. What are the foramina of the posterior cranial fossa? 4 foramina pass through this fossa: internal acoustic meatus, jugular foramen, hypoglossal canal, foramen magnum. Following contents pass through this foramina. Number 1. Internal acoustic meatus. It is a canal in the petrous part of the temporal bone. It transmits cranial nerves 7, facial nerve, and cranial nerve 8, vestibulocochlear nerve, labyrinthine artery. Number 2. Jugular foramen. It is located between the temporal and occipital bones. It transmits cranial nerves 9, glossopharyngeal nerve 10, vagus nerve 11, accessory nerve, internal jugular vein, inferior petrosal sinus. Number 3. Hypoglossal canal. It is found in the occipital bone, near the foramen magnum. It transmits hypoglossal nerve, cranial nerve 12. Number 4. Foramen magnum. It is the largest foramen, located centrally. It transmits medulla oblongata and meninges, vertebral arteries, spinal roots of accessory nerve.